Sure I am.
Yeah.
All right, let's go ahead and get started. Sanghani is going to talk about the economics of medicine and your financial health. It's a very interesting topic for everybody. So,
good morning, everybody. Like Dr. Bokini said, my name is Rachana, and I'm a fourth-year Med-Ped resident. I really wanted to thank everyone for coming here today. I really am interested in this topic, and I think it's really something that we don't get a lot of information about, either during medical school or during residency, and so I thought that I would take a shot and give you guys a little bit of information. I hope you guys learned something about savings and paying off student loans and things like that. There are some handouts and things like that in the front. Some of them are just examples. If people are interested in getting those handouts, I can get more of that. Some of it is just about making a plan, more like budgeting stuff. And then one that I think is really important is important contacts and websites. So if you're interested in knowing about this information, learning more, you can pick up one of those handouts. And again, if anyone wants any of this stuff, let me know. I can make some more stuff. So as far as my disclosures, can you guys hear me? Because I don't have this on. Can y'all hear me? Okay. As far as disclosures, I don't have any relationship to anything that I'm doing, no incentives, I'm not getting paid. There are names and organizations and companies and things like that that I talk about throughout. It's really based more on personal experiences, and it's just to give you guys an example of people that I've used. So just a little bit about the outline of what I'm going to be talking about today. I'm going to touch a little bit about the economics of medical school, and you'll kind of get a better understanding of this in the next couple of slides. Managing debt, specifically student loans, and then I'm just going to really briefly touch on credit cards and other fixed expenses. It's really just a slide. And then last but not least, savings, because I think this is a really important thing that a lot of residents and medical students kind of miss out on. They don't really think about it, but you got to. And you'll understand why that's so important kind of towards the end of the discussion. So there's 3 savings plans that are offered to us at LSU. It's called the Empower Retirement, the IRA Roth accounts, and the Supplemental Savings 403B, okay? And there is a handout there that kind of has financial terms in it. So if anyone wants to pick that up, or if wants that when they go home so they can kind of understand this, because it can get a little confusing and a little boggy. So just a little bit about my background and why I'm so interested in this topic. I was telling Dr. Bokini when I was a medical student in my 3rd year, I got a lecture from one of these companies called GL Advisor where they talked about all this stuff, and I thought it was so important. So kind of since then, I've been really taking a big interest in it. Also, I've got my bachelor's in arts in finance from the McCombs School of Business at UT Austin. And when I was there, it was one of the top 5 business schools in the country. I'm also part of an investment club. I know this kind of sounds funny, but this is a real thing. We've got members, we've got like a constitution. At this point, it's worth over $1 million. So it's a really kind of a big thing that I take part in it every month. And then I've got my master's in public health. So why is this topic important? So if you research doctors and finances, they are notoriously known to be very bad with their personal finances. And there's a lot of different reasons for that. One, they're just not knowledgeable. They don't have the time to really sit down and think about what's going on with their finances, because throughout medical school and throughout residency, you're so bogged down with medicine and doing what you need to do to take care of your patients that you really have a little time to think about some of this other stuff, or at least I did. Because of these reasons, physicians are really easy targets, and they can be taken advantage of by financial advisors, especially if they have no idea what's going on with their own finances and they don't know what options are available to them. Another important reason that doctors are really bad with their finances kind of boils down to this. One, as a physician, once you come out of medical school, and we'll talk about the numbers in a little bit, but there is a huge amount of debt that most physicians are in once they graduate from medical school. So at a certain point, they take out loans without even thinking about it. They take out too many loans, not thinking about whether they need to really be taking out that much money. Also, because of all the schooling that they're in and the residency, they have a delay in savings. And this is going to be really important towards the end of the discussion because I'm going to talk about something called time value of money. And that's where, when you have this delay of savings, it really is a really big deal. And then the last thing, which I think is really important, most medical students and residents really don't have a lot of money unless you are independently wealthy and have some parents that you can freeload off of. But so really, once you get that first job, you're so excited about making some money that you don't really spend your money wisely, and you might buy a $50,000 BMW when you've got $250,000 of debt. So, and that's not always the best decision. So some people have said that going into medicine is a $1 million mistake. I wouldn't necessarily agree with that. Obviously, we're all doing this because, we really want to help people, and we've got other drives for us, and finances aren't always the important thing, but it is something that you've got to think about and you've got to take seriously. Lastly, more and more we have to talk about medicine as a business. You know about this through all of our ICD codes that we're doing. If you're trying to open up your own private practice, if you don't have your own financial situation kind of squared away, it's really hard to go in and open your own private practice. So there's this really great website that I came across. It's actually a blog. It's www.whitecoatinvestors.com. I think it's an excellent blog that everyone really should at least check out. They've got tons of articles and postings about different financial mistakes that physicians make, helps them talk about taxes, a whole slew of financial things. And one of the posts that they had talks about the top 7 financial errors that most physicians make in a way that you can help those. So number 1 is poor debt management. So again, it's such an important topic. And this is really what most of my presentation is going to be about today. Inadequate savings rates, which basically means that you're not saving a good percentage of your income like you should be. And inappropriate tax management, personal and professional divorce. In this article, I actually saw that if a physician's married to a non-physician, the divorce rate is about 45%, so almost close to the national average, whereas if a physician's married to another physician, interestingly enough, their divorce rates are much, much lower, which I really wasn't expecting that. The wrong insurance. So this really talks about disability insurance, life insurance, things like that. Talks about how a lot of times we get the wrong kinds of insurance and not enough of the good kind of insurance that we really need. And last, expensive investments and loaning money. And this really is just talking about how sometimes when you come into a lot of money because you are now in this profession you're in attending, people will be asking you for money. So, educational student loans. A little bit about the economics of medical school. So overall, this is a really, really hot topic right now. I don't know how much people follow politics, but there's been a lot of things legislatively that have changed over the course of the last 10 years. Obama's done things during his term as president that have changed the way that student loans and interest rates work. One of the platforms that Hillary Clinton is going to be running on in 2016 is really going to focus on this, and so it really is a national issue. The national education debt in 2013 was over $1 trillion. That's a significant amount of money. They say it's growing faster than inflation, and about 1% of all student debt, or people who own student debt, is over $100,000. That's a significant amount of money, and this is really important because this is kind of where, even though it's only a small percentage of the overall debt, this is exactly where medical students and residents fall, because they are the people that have over $100,000 worth of debt. So a lot of people talk about the cost of going to medical school, and this kind of goes back to what I was talking about, the $1 million, you know, the $1 million mistake. So there is an opportunity cost that's involved with going to medical school. That comes in forms of not only savings, the lack thereof, not being you're accruing debt during medical school. You're also losing out on wages that you could potentially be earning during your time in medical school. Like I talk about the tuition, boarding, books, that kind of all goes under debt. So the AMC, which I didn't know this because I went to a foreign medical school, apparently whenever you graduate from a US medical school, they give students 2 questionnaires. One's called the graduation questionnaire and one's called the tuition and student fee questionnaire. So these are really, this is kind of where the AMC gets all of their information from, all of their numbers from, to talk about the amount of debt that medical students are in when they're graduating. So income. Whenever you think about income, you've got to think about a couple of different things and how you're going to be using that income. A lot of people get bogged down and think that they need to focus all of their income on paying their expenses. But you cannot forget about the savings and retirement part of that. Paying off your expenses is very, very important. But if you're not saving, then you're going to come into trouble when you get ready to retire. So there's different kinds of expenses. You've got fixed expenses and variable expenses. As far as the fixed expenses, there are things like your student loans, because that's going to be something that you're going to pay the same amount every month. Your any kind of insurance that you have, disability or life insurance. And then your variable costs would be kind of like your discretionary income that you spend on hobbies, interests, your credit card payments, gas and groceries and things like that. The important thing at this level is that you need to really be good about budgeting. And so there's actually a couple of different resources that you can use that are available for you if you want to learn how to budget the income that you have. There's one booklet up here. It's an empty booklet that you can write in, and you can literally write everything down. It's got spaces for all your bank accounts, for any kind of insurance that you have, any kind of retirement plans that you have, all that kind of stuff. But there's tools online that you can use as well. I use Mint. I love Mint. I don't know if anybody knows what Mint is, but it's this great resource online. You can create an account and you can input everything in there. And the good thing about that, having something online, is that it actually links to your bank accounts, your credit cards, any kind of retirement plans that you have. And it's real time, tells you what's going on with those accounts. And it tells you not only your expenses, but also your income. So it kind of tells you what your net worth is. And you can import all this information into it. So it's a great tool. I really like it. The AMC also has something called SALT. If you go to this website, and you'll see links for it, you can go there and they can help you do some budgeting stuff as well. So this is going to be a really important slide because this is for the graduating class of 2014. When the AMC did their annual surveys at the end of the year, they kind of went through and talked about what the amount of debt was that graduating medical students in 2014 had. And we'll talk about these numbers on the next slide. So the median cost of attendance for a 4-year medical school at this time, if you're at a public school, is over $225,000. And if you're at a private school, it's almost $300,000. The class of 2014, whether they were in a private institution or a public institution, about 84% of these medical students graduated with some sort of educational debt. This does include undergraduate debt, but often that undergraduate debt is really just a small percentage of the overall debt that they have. The median debt for any graduating student in 2014 was $180,000. With 40% of graduates having over $200,000 of debt and about 10% of graduates having over $300,000 of debt. So by the time you haven't even made any money yet and you're already $300,000 in debt. I mean, I think that's a big deal because it really can impact the rest of your life if you are not frugal and you're not conscientious of what kind of debt you have. So really the important thing here is to get organized. Know your loans. You need to be keeping all of your loan documents to keep track with everything that's going on. You need to know the difference between a lender and a servicer. The lender is the person that actually lends you the money. The servicer is the person that may actually, they're the ones that you're actually going to be in contact with because they're going to be the ones that you're going to be paying your monthly payments to and things like that. But you really need to be aware because a lot of times your servicers are frequently changed, like they sell your loans to different people. So when I started here, it was really hard, and it's not easy. They don't make it easy for you. You've really got to track that stuff down, and if you're not keeping track of it, you know, I mean, I have my stuff all the way from undergraduate school. So if you're not keeping track of this stuff, it can become really difficult to find. But there are some resources online where you can find your loans. So the National Student Loan Data System, it shows you what all of your federal loans are. This is from undergraduate and graduate school. So it's a great website to visit if you really just don't even know where to start as far as your federal loans are concerned. If you've got private loans, you need to go directly to the lender, either call them and they can send you the documentation so that you know that. Also, another good place to look would be looking at your credit history. So annualcreditreport.com, you can get yearly credit reports, and on there it will tell you if you've got any outstanding debt, where it is, how much it is, what your interest rates are, things like that. If everyone's not checking their credit report at least once a year, you really should, especially in this age when you've got lots of identity theft and things like that. You really need to be keeping track of this and making sure nothing's going on. Some information that you need to know about your loans. You need to know the name of the loan, the disbursement date, because this will tell you what your interest rates are, and the servicer, and it'll tell you what kind of loans you have. Are they subsidized, unsubsidized, Perkins loans, other institutional loans, things like that. So I just give a couple of terms here. I was just talking about other institutional loans and Perkins loans, but these are usually the ones that most students and residents are going to have. You're going to have Stafford loans, and there's subsidized loans and unsubsidized loans. So the main difference is if you're in certain repayment programs, your subsidized loans, usually for up to 3 years, the federal government will cover the interest on those loans. Whereas the unsubsidized loans, if you're not paying, that interest is going to continue to accrue. And at a certain point, whenever you actually go into repayment, that's going to capitalize, which is a really big deal. And I don't know if anyone's not understanding any of the terminology that I'm using, but if you're not, just let me know. Capitalize just means that you've got a principal amount, which is the amount of loan that they give to you, and then you've got a certain percentage of interest that they charge you for borrowing that money. And if you're in different repayment programs, if you're not paying off that interest, it will get tagged on to the principal amount of your loan, and eventually that interest that you got will get interest on the interest. That's called compounding interest. But I know that's a lot, but if anyone doesn't understand, just let me know. So like I was talking about some legislative things that have been going on, these are really important because these are going to probably impact everyone here except for people like Billy Branch and Kenneth who don't have any loans. There used to be something called economic hardship, which was what, for the majority before 2007, this is probably what all residents used to go into, and this just means that they were deferring their loans until they got out. The good thing with economic hardship was that whenever you had subsidized Stafford loans, this is what I was talking about, where the government would pay it for up to 3 years, that interest, and it wouldn't accrue and capitalize at the end. However, this is really, really hard to get at this time. They still have something called deferment, but it's really not something that most residents are going to qualify for. There's something else called forbearance, which a lot of people in residency do. It may or may not be the best option for you. You've got to kind of figure out where you stand and what your future goals are. But forbearance is that you postpone all your payments under those circumstances, but With forbearance, you actually continue to accrue interest on both your Stafford subsidized and unsubsidized loans. So whenever the federal government used to give loans, they used to give it through private lenders, and that's why it got really confusing, because they would keep selling those loans over and over again. But in 2010, federal loans were no longer able to get originated from private lenders. It's now all through the Department of Education loan program. And if you've got other loans, there's something called consolidation. If you had loans from before 2007, or 2010, that you can go into consolidation, and then all your loans would be at the Department of Education. This may or may not be the best option for you, and we'll talk about that later. Also, as far as, since July 1st, 2013, interest rates on student loans started to become tied to the economy. And this is a really big deal because, over the last 5, 6, 7 years, the U.S. has been kind of this economic downturn and with the recession and everything. And so interest rates really went really, really low. Like, you could get a 2% interest rate on a car loan, which to me is ridiculous when you're paying 7% on your Stafford loans or your graduated plus loans in order to go to medical school. And so this became a really big deal. I mean, they didn't drop interest rates that much, but it still was better. I mean, you could get loans for 5, 6%, which is much better than 7, 8%, which is what it's been in the past. So now you come to the options of what are you going to do. You have these student loans. Are you going to postpone your payments, or are you going to go into repayment? And this is really a decision that you need to make kind of towards the end of your 4th year of medical school. One of the things that I would really encourage all 4th year medical students to do is to file their taxes. If you've not filed your taxes, and most people think, well, if I'm not making any money, I don't need to file my taxes. But you'll see later when I talk about the different repayment plans, when you file your taxes they use your previous year's income to determine what your payments are going to be on a monthly basis. And so if you file for this year, if you're a 4th year medical student, you're graduating, you filed for 2014, whenever you become a resident in July, they look at the fact that you didn't make any money, and your monthly payments can actually be 0, which happened for me, which is an amazing thing. And if you're in different kinds of programs, that can be really, really helpful. There are a lot of tools online that you can use that can help you decide whether you want to postpone payments or if you want to go into repayment. At that first website, and I really love this first website. I got a ton of information from it. But there's this thing called MedLoans Organizer and Calculator. It's free for all medical students, any previous students, and administrators. All you need is your AMC ID and your password. If you don't have it, it's really easy to contact them because I don't remember any of my stuff. I was able to contact them. They gave me my information. They reset my password. It took and they're great at responding. The good thing about this is that you can actually upload all of your loan information, your actual information, into this so that they can tell you specifically what would be the best option for you, or you can manually enter it. There are some other tools that you can have as well. If you go to myfedsloans.gov, they also have calculators there where you can put in the amount of debt you have, the interest rate that's on it. They'll ask you about your household side, what your adjusted gross income is, things like that. If you input all that information, they'll tell you what your payments would be on a monthly basis and all the different repayment plans. There are people that you can use, CPAs, personal financial advisors. They really can be very helpful. Like I mentioned earlier, I got a lecture from GL Advisors when I was a 3rd year medical student. And I actually ended up using them in my 1st year as a resident. They helped me decide what to do with my loans, whether I should consolidate, what kind of things I should do with it. But GL Advisor is really not around anymore because they got into some financial troubles. So I got to use them, and it really helped with what I needed to do, but there are other groups. So you just need to be really cautious whenever you're talking to people. Like I mentioned earlier, Physicians are a niche group, especially for these financial advisors, and they will try to take advantage of you if you really don't know what you're doing. Another group that I'm actually using right now, and again, like I said, these are just examples of people that I've used that I really like, that I'm not trying to sell anybody or anything like that, but I use a group called Affinity Group, and they're really amazing because they will do they'll look at all of your finances, your income, your expenses, your student loans, everything. They'll look at everything for free during residency and for the first year outside of residency, and they help you organize everything. They actually help me get my disability insurance. They help me get my life insurance. Like, they've been wonderful, and we've been using them for a year. So just something to think about. So if you decide that the best thing for you is to postpone your payments, like I talked about, there's a couple of different ways that you can do that. You can do economic hardship or deferment or forbearance. Most medical residents are not going to qualify for the economic hardship, but most people will qualify. I mean, there's something called like a mandatory medical forbearance, which is basically for residents, and you've got to just apply annually for this. It's just supposed to show that you're not in a financial state right now that you could make the monthly payments. But like I had mentioned earlier, the median debt for medical students in the graduating class of 2014 was $180,000. So if you use that kind of as our base as an example, if you decide that you want to postpone payments, you will be incurring about $1,100 in interest every month. And remember, under forbearance, all of this will capitalize at the end whenever you decide to go into repayment, whenever that is. So your final cost of that loan, whenever you really if you're in a 3-year program, that final cost is going to be about $208,000. Plus, now you're going to start earning interest again since you're going back into repayment. So the key here is that even if you're in a forbearance kind of payment system, you should try to make some type of payment during that period. The good thing about this is that it doesn't lock you into any monthly payments, but say you've got like 1 month where you've got a few $100s or $1,000 or $2,000 that are kind of laying around, which doesn't happen often, but if you've got something that's there, it really is important to try to make some type of payment, even if you are not making a monthly payment. So some of the other options that people have if you actually decide to go into repayment, there's 2 general categories. There's called traditional repayment, and then there's income-driven repayment. Under your traditional repayment, most residents don't do any of these traditional repayments because it's just not feasible during residency. So the first one is standard repayment. This is a 10-year term, which means that you've got to pay back your loans in 10 years. This is really aggressive repayment of your loans. Depending on the amount of loans that you have, this could be anywhere from $2,000 to like $4,500 a month, which that's more than we get paid in a month. So that's not really feasible during residency. But you do accrue the least amount of interest and the interest that you pay would be the least under this payment plan. There's something called the extended repayment plan. This is a 25-year term. It lowers your monthly payments, and you have to owe at least $30,000, which most of us will. Again, you're going to have, because it's a longer term, you're going to have more interest that's going to accrue. So in the end, you'll pay a bigger amount in the interest that you're paying. And then there's something called the graduated plan. This also is a 10-year plan. However, the way that it's different than the standard plan is that for the first 2 years, you only pay interest, and then in your 3rd year, it jumps to a significant amount to include your whole monthly payment. So now it's going to be your principal plus your interest. So as far as other repayment plans, so this is the income-driven programs. There's 3 different kinds under the income-driven programs. And what I've listed at the top is relevant for all of the programs. It's purely based on your adjusted gross income and your family size. And so a lot of people who are married think that filing as a joint married couple is always, that there's a lot of tax benefits that come with filing jointly. However, if you've got a lot of student debt and say your significant other or your spouse is making a significant more amount of money as compared to you, this actually could be detrimental. And the reason for that is because couples who are married and filing separately, it will only look at your adjusted gross income. So as a resident, an intern, you're making $45,000 a year, they will only look at that to determine your monthly payments. Whereas if your significant other is making 90, they look at the combined income and decide on a monthly payment based on your combined income. So you really need to think about these things and see whether or not filing together is the best option for you. There are some states in the country that are called community property states. Louisiana is one of those. I tried to get a little bit of information. I contacted the AMC to see if they knew whether or not, because whenever you're in a community property state, basically what happens is that they total your income and then they divide it in half. But I'm not sure whether or not they still will only look at your adjusted gross income or if they look at what that half number would be, what the mean would be. So, and I haven't gone through that yet. My first year going through that will be next year, or this year, so when I file for 2015. So I can always let y'all know if y'all are interested in knowing how that works out. Also, if you've got other loans, say you've got a Perkins loan from undergraduate, you've got other institutional loans that either your medical school or your undergraduate school gave you, these will not qualify for any kind of income-driven programs unless you consolidate. Because as you'll see, in order to qualify for these income-driven programs, you have to have something that's called direct loans, which is those Department of Educational direct loans that I was talking about. You have to do annual applications and all the forms, and I have an example of one of the forms up here for the income-driven. All the forms can be found at that website. So there's 3 basic income-driven programs. There's income contingent, income-based repayment, and pay-as-you-earn. With the income-based and the pay-as-you-earn, there's a partial subsidy. So it really depends on the percentage of your portfolio that has subsidized debt. That's how they'll decide how much of a subsidy you get. And then also with these 2 programs, there is certain kinds of forgiveness, which means that after a certain period of time, if you've made certain payments, they'll forgive the remainder of your loans. The one thing that I do want to mention is that all of the information I'm talking about is the most current rules and regulations. These things can change. There has been talk about this when I was talking about the married filing separately versus married filing together and looking at the income. There's been talk on both sides of the aisle to change this, that whether you file together or separate, they're going to look at the total income if you're married. So this is something that could change, in the next 5-10 years, probably earlier than that. So specifically about income contingent repayment, this is a 25-year term. Again, only direct loans you're only able to use direct loans to get this repayment program. It lowers your monthly payment, but remember we were talking about capitalization of your interest at the end whenever you enter repayment. The good thing about this is that they cap that at 10% of the original amount, which is a really big deal. It also your monthly payments will only be 20% of your monthly discretionary income, or they'll calculate what your monthly payment would be on a 12-year plan, and then they do a percent factor of that, and that's all based on your income. And like I said, forgiveness is available. Income-based repayment. There have been changes made to income-based repayment already. So the stuff in red are the new changes. And this is from July 1st, 2014. If you were income-based repayment, or if you had loans prior to July 1st, 2014, all the black applies to you. So all the black really applies to all of us, because none of us here had loans after July 1st, 2014. Everyone had their initial loans before July 1st, 2014. So your payments cap at 15% of your discretionary income. So already you can see the difference between the income contingent 20% versus 15%. And for those who have loans after July 1st, 2014, your payments cap at 10%. So they've actually made it so that you're making lower monthly payments after that. You can never exceed the payment of a standardized payment under this plan. So if you had what they do is they calculate what it would be for a 10-year standard repayment plan, and if the amount that you're paying back in your standard is much higher than what this 15% of your discretionary income is, you're going to qualify for this program, and that's what you're going to pay. This is a 25-year term. For the newer borrowers, it's a 20-year term. But remember, after those 25 years, if you've made payments on a monthly basis, the remainder of your loan can be forgiven. But whatever they forgive, the federal government says that it's income and they can tax you on it. Most of the time, most people are not going to have that much loans that after that 25 years of payments that you're really going to have much left. But there are other forgiveness programs that you could take advantage of where you could get stuff forgiven. And like I said, you've got to qualify for partial financial hardship. This only is true whenever you initially enter into IBR. So, for example, if you are a resident, you decided that you wanted to start repaying your loans as an intern, and you start with IBR, all you have to show to qualify for that is at that moment in time that you have a partial financial hardship. Once you're done with residency and you go on to be an attending and your income balloons, it doesn't matter. You're still going to qualify for IBR because when you entered into IBR, you had already qualified for it. And like I mentioned earlier, if your payments are under the 10-year payment under IBR, then you qualify for it. Does anybody have any questions?
I do. For the IBR, you have to reapply for it every year.
Yes, you do.
How do they consider?
So it's not that you're actually reapplying for it. All you're doing is sending in documentation of what your income is so that they can adjust your monthly payments. That's it. Yeah. Because you do, and it does get a little tricky because it looks like they're asking you to reapply for it. And you can see I have an income-based or income-driven application right here. All it says is that if you can check the box that says I want to stay in the same payment plan that I was in last year, and I'm just going to give you my updated income information. Any other questions? Okay. So there's another thing that's called pay as you earn. Unfortunately, this is not going to be something that probably a majority of us in this room are going to be able to qualify for. Again, it's only direct loans that can qualify for this repayment plan. But there is a couple of things that you, in order to qualify for this, that you don't have to have for the IBR. So you can't have had any outstanding debt as of October 1st, 2007. So say you had undergraduate debt, you went and worked for a couple years afterwards and you paid off all of your undergraduate debt before October 1st, 2007, then potentially you could qualify as long as any other loans that you received were not dispersed until or after October 1st, 2011. So this makes it this is really more for people who are in undergrad right now. They're going to be really able to take advantage of this. Payments cap at 10% of your discretionary income. It's a 20-year term. Again, whatever is remaining, they'll forgive it after that 20-year term, but it is taxable. And interest capitalization is 10% of your original amount owed. So pay as you earn is kind of a cross between income contingent and income-based repayment. And again, you've got to show some sort of partial financial hardship. So this is taking the example of the median income of $180,000, median debt of $180,000. If you decided to do forbearance during residency and then you decided to do the standard 10-year payment plan, you would incur about $148,000 of interest, and your total repayment amount would be about $328,000. And then it kind of talks through some of the other ones, different examples, like if you decided to do either pay as you earn or other forbearances during residency, what your amounts would add up to. And really, you got to plug in your numbers, go to that MedCalc or go to FedStudentGov and figure out a calculator what your payments would be. So as a borrower, you also have rights. So a lot of loans, like if you get a car loan, a lot of times they won't let you pay off quicker than whatever their monthly payments are. However, with your federal loans, you can pay it off as quickly as you want to. If you have a 10-year term or if you've got a 20-year term and you want to pay it off in 5 years, you're allowed to do that. There's no penalties for that. All federal loans have a grace period. It's usually 6 months. This is usually when you get out of school and you're just starting residency. You'll have 6 months where they say you don't have to make payments. But again, it's advisable that you try to make some sort of payment because while you're not paying, interest is accruing. The thing about grace periods is that not all loans will have them. Most federal loans will, but other loans like private loans may not have a grace period. And any leave of absences or any kind of anything that happened during undergraduate could affect the term of your grace period. So for example, I took a year off between med school and undergrad. So that I already used my 6-month grace period at that time. So when I came into residency, I no longer had a grace period and I basically had to either decide if I wanted to do forbearance or go into repayment immediately because I had already used my 6-month grace period when I graduated from undergrad. Consolidated loans usually don't have a grace period. First rule of thumb, you really need to pay off your high interest loans first. And this includes your credit card debt because a lot of times depending on your credit scores and your credit history, interest rates on your credit card could be anywhere from 18 to 25 to 30%, which is ridiculous. So you can't forget about paying back your credit cards. Sometimes that might even be more important than paying off your student loans if your student loans are only 5–6%. You cannot refinance federal loans, which is really a disservice, I think, because like I said, you can get car loans for 2–3%, and a lot of our loans are 6–7%, and you can't do anything about it. Those are fixed rates, they're never going to change. But one thing that is good is that whenever you sign up for a repayment plan, you can have automatic withdrawals, and if you decide to do automatic withdrawals, you can have a rate reduction of up to 0.25%, which doesn't sound like a lot, but it's better than nothing. You need to find out from your loan companies when they capitalize and how often they capitalize, and you need to decide whether or not you should or shouldn't be consolidating your loans. These are all really individually based, and you need to look at your debt and your income and decide what's the best option for you. So like I said, it's really about your goals. It's hard as a 3rd, 4th year medical student and even maybe a 1st year resident to really know what your goals are. Do you want to go into fellowship? Do you want to open up your private practice? Do you want to go into academic? But you need to start thinking about those things because it really can affect how you decide to pay back your loans. Because like I said, residency programs, fellowships, for some of the loan forgiveness that you can get, residency and fellowship count towards that. So it's just really based on what your goals are. Ease of flexibility, minimize your payments, free money, which is the forgiveness programs, and if you want to minimize your debt. So the forgiveness programs. 40% of medical school graduates in 2014 said that they were interested in getting some sort of free money. When I say free money, I mean getting some of their debt forgiven at a certain point. So there are a few different places that you can go to find out what options are available to you. A lot of times when you have an employer, they also may give you a certain amount of money to put towards your student debt and things like that. So that's also another option once you start working. But www.aamc.org/stloan. This is a great website. You can actually put in any state and it'll tell you what loan forgiveness options are available for you in that state, which is great because I was able to find stuff that I didn't know existed. There's also something called public service loan forgiveness, which is a really big deal, and we'll talk about that in a second. Through the NIH and the NHSC, there's also loan forgiveness options there as well, where they basically give you a certain amount of money to put towards your student loans. As far as public service loan forgiveness, this is a big thing that's come out recently. In order to, you have to qualify for PSLF. So a couple of the things that you've got to have in order to qualify for it, you've got to have eligible loans, which means you've got to have the direct loans. You've got to be in a qualifying repayment program. So that means if you're under the standard repayment plan or if you're in any of those income-driven repayment plans, then you qualify to take advantage of PSLF. The third part of that is that you've got to be in some type of qualifying work. A lot of people think that this means that you need to be in an underserved area, but that's not true. For PSLF, all you have to do is work for an entity that's tax exempt or considered a nonprofit. Most residency programs are considered a not-for-profit institution. LSU is considered a not-for-profit institution. So you can take advantage of this here. And remember, even when you're in fellowship, that also qualifies as well. Any questions? Okay. As far as public service loan forgiveness, again, like I said, you need to meet the eligibility requirements. You have to have direct loans. So if you've got other loans, you've got to consolidate them. Like I said, most residency and teaching hospitals qualify. The term of this is a 10-year payment. You've got to make 120 monthly payments. If you pay, say you had $100 was what your monthly payment was, and you decide, okay, this month I'm going to send in $200 and next month I'll send in $100. Or next month I won't send in anything. You can't do that. If you pay more than what your monthly payment is, it's of no advantage to you. They don't say that they take off an extra month because since you pay $200, that counts as 2 months. No, it doesn't work like that. You pay the monthly payment and that's it. Each month you pay is what qualifies you. And you've got to have 120 payments. They don't have to be consecutive, which is great. So if you decide, like for example, when I graduate, I probably won't start working for a couple months. So my payments towards public service loan forgiveness will stop when I graduate. I still have to make the monthly payments, but they don't qualify for public service loan forgiveness. They only qualify once I start working again. And the great thing about this is that whatever money gets forgiven after your 10 years or 120 payments is not taxable, which is a big difference from that. However, there's changes that a lot of people are talking about. People from both sides of the aisle are talking about limiting the amount that you can get forgiven. So it is something that you should think about and really decide. This really should be for people who really want to do some sort of academic institution, public service kind of stuff. And that's what they're trying to tell people because they don't know what kind of changes are going to happen. So you do have to have an employment certification form, and there's a form up here if you guys want to look at what it looks like. So beware just what I talked about. Okay, the last thing, I'm almost done, probably just 5 more minutes. Savings and retirement. It's really, really big and important. As far as savings and retirement, I was talking about the time value of money. Most physicians are already behind the curve because by the time they really can start saving, they're already 8 to 10 years behind their peers who didn't decide to go into medical school. And so the earlier you save, interest starts compounding as the years go on, and there can be a drastic difference in the amount of money you have saved in retirement the longer you wait to save. So even if you're saving $50 a month or $100 a month, you need to do it because it really, really is important. You need to do it now. You need to be aware of the options that you have available to you as a resident, what your employers offer, and I'm going to tell you about the options that we have here as residents. A lot of employers, not usually for residents, but depending on what system you're in, but for attendings and things like that, employers sometimes match these amounts. So if you're not maxing out your 401k, you're losing free money. You should do it. And again, it all comes down to budgeting and knowing how much you need to be saving, how much debt you have, what your other expenses are. Remember, don't forget to pay yourself because you're just as important as paying everybody else. Okay, so LSU options. If residents are not in this deferred compensation plan, the 457B, I don't know what you're doing. You need to be in this program. This is your pre-tax dollars and it's tax deferred. This is an option that's available to residents in lieu of paying into Social Security. This is probably one time in your entire life that you're going to be able to opt out of paying Social Security. And frankly, we really don't know if Social Security is going to be around whenever we get to that age. So if you're not, and for Social Security, they take out 6.25%. For your deferred compensation plan, they take out 7.5% of your paycheck before you even see it. So you don't even have it. You're just putting it away without even thinking about it. If you are not doing this, I have the name of the person. I really, really, really strongly encourage you to do it. Of course, you need to look at your finances and look at your specific situation as far as your household, other income that you're having. Can you do this? You're already going to put away 6.25 into Social Security, so really you're just putting 1.25% more, and you have direct access to this money. Only 75% of residents in this institution are actually taking advantage of this right now. And you have full access to this money about 30 days after you leave. You do have to pay income taxes on this whenever you take it out of it, but you don't have to pay a fee. And you'll see with some of these later options, if you take it out before a certain age, you have to pay a fee. For this one, say you leave LSU and you go somewhere else to go work, you can take your money out, you'll pay the income taxes on it, but it's worth it to pay the income taxes now because you're probably in one of the lowest tax brackets you're ever going to be. So you might as well pay the taxes on it now as opposed to later. There is a cap on how much you can put into this. The annual cap is $18,000. The other LSU options that are available that I just learned about, I didn't know about these, there's something called 403B, and this is basically like a Roth account. So it's another retirement plan. It's kind of, there's something called a 401k that most private companies will give to their employees. This is kind of the counterpart to that for certain tax exempt entities. You can have a traditional 403B or you can have a Roth 403B. The traditional 403B is tax deferred. So again, these are pre-tax dollars that you take out of your paycheck every single month and you put it towards something or put it in a retirement account. The Roth are after-tax dollars. The big difference between these two is that with the Roth, you pay the taxes now, and that whenever you decide to take out your money, whenever you turn 65, 70, you are not taxed on taking that money out. So that's a really good, in my opinion, at this stage, given the income that we're making, doing the after-tax dollars is probably a better bet for you. Some employees match this contribution amount. LSU does not do that. Again, with this one, if you take your money out before you turn 59 and a half, not only will you, if you're in the traditional, not only will you have to pay the income taxes, but you'll have to pay a 10% federal fee, which you won't have to do if you have the 457. Again, the cap on this is $18,000. And then you've got your IRA. This is just an individual retirement account. This is something that you can do on your own with companies like Vanguard. In order to pay into IRA, there are income restrictions. I have some information on that. I think it's about 100. If you're making more than $180,000 as a married couple, you can't contribute to this. And so your only option would be whatever your employer is offering you. And again, they have both options as well. They have the traditional and the Roth, the pre-tax and the after-tax. The limit that you can contribute in any given year is $5,500. So this 403B is a really good option if you and like I said, $25, $50, $75, you need to think about it. There are 3 companies that are working with LSU for this 403B. I have their information here. Actually, I have it here too. So the deferred compensation plan is someone named Bo, and then there's 403B plans is Voya, Valak, and T. So this is just their information. If you guys are interested in knowing more about these plans, even if you're saving $75 a month, it really adds up in the long term. These are my resources. Thank you. Anyone have any questions? No.
I think this is terrific, and the main thing that you need to do when you graduate, especially if you're not going into a fellowship, you need to live like you're living now.
Yes.
For a few more years, because you can almost pay everything off in about probably 5 years if you're living just like you are, and you can still take a vacation every year. You can still, you can still live better than you are now. But if you'll just delay gratification for a few more years, you'll be done with your loans, and then you'll be able to not be saddled with that debt. And it's, but it takes a conscious effort to be able to do that.
And you really need to think about it now. You can't wait until you graduate. Medical students, you should think about it now.
You guys have a lot than we had. And one thing, I guess my generation of people, once our student loan set, like we can't refinance, can't get this great interest rate you get, when
we can't refinance either.
But when I was finishing medical school, if you could get like 8 or 9%, they would like consolidate now. You guys it's much lower than that for you guys now. So, some classes after me, they were at 3 and 4%.
Yeah.
Like that was never anything that we could have gotten.
Most people now probably have anywhere from 5 to 7% on their federal loans.
Like that was unheard of 20 years ago.
Yes.
Do you need to consolidate? You hear different things that some people say it's better not to consolidate.
So it really depends on your loans, your interest rates, and what you're trying to do. If you're trying to get into one of the income-driven plans, if you're trying to take advantage of public service loan forgiveness, and if you have other kinds of loans that are not just federal loans, you've got Perkin loans or other institutional loans, the only loans that'll qualify you for those income-driven plans is going to be the direct loans. So in that case, yes, you do have to. So it's based on what your goals are.
And you need to pay off that credit card debt first.
Yes.
And then if you're putting, $2,700 a month paying off credit card debt, then once that's paid off, you put that into your loans, whatever the highest interest rate loan is.
Right. If you don't consolidate,
into it.
If you don't consolidate, then you always pay off your highest interest rate debts first. If you do consolidate, the one thing with consolidation now is that the way that they do it, it's like what they call it a weighted average rounded up by 1/8%. So it kind of sucks because they round it up, but it's a weighted average. So they take whatever all your loans are, see what the interest rates are, see what percentage of your portfolio is made up of these different interest rates, and they decide, they weight it all out. It's all this, it's a formula that they do. They weight it out and then they round it up by 1/8%. I do have consolidated loans, but it was the best option for me.
And I think when you graduate, you need to sit down and talk to somebody and be honest about what you want out of your lifestyle, where you are financially, because I waited till I had some serious transitions in my life to sit down with somebody, and that put me a few years behind where I could have been. But I listened to some of my friends, and they don't have retirement thing. They have just a minimum at work, or they don't have life insurance that they need for what they're doing. And sit down, find somebody, if it's somebody that your parents use, if it's someone that your colleagues use. I really think you should sit down and talk to someone and be very honest about what's going on with your life financially and emotionally, because they can give you some really good advice so that in 10 years you meet these financial goals, in 20 years you meet these financial goals, because you know, you have to pay to play, and more money, more problems. So you make this money when you come out and you start, you know, driving this and living this way, and it can catch up with you. So you really, I think you really should talk to somebody. This is a lot of information that, you know, no, 20 years now I understand it, but I don't think you guys really can grasp what you need to have grasped from this lecture, because it's so much good information that you need to talk to somebody and just really work through everything that she said this morning, because it's all important. It's all very important. And then kids, you didn't put kids on there. You know how much a kid costs?
I mean, there's a whole nother lecture that I could have given. There was so much information. I have tons of information about disability and life and all this stuff, but didn't have enough time to talk about all that stuff.
So that's the bottom line. So thank you. It was great.